You know all that stuff you hear about how great the economy is doing. Well, it all depends on who you are. The gap between the rich and poor is not just about money, it's also about happiness. A new study confirms the idea that low-income Americans are sinking into despair, as The Atlantic reports. The authors of this paper, published this week in the Proceedings of the National Academy of Sciences, relied on a survey called Midas, Midlife in the United States, that interviewed American adults about their mental health in 1995-1996 and again in 2011 to 2014. The study found that for the poorest whites in the sample, mental health consistently declined between those two times, suggesting low-income white Americans have become far less happy over the years. Meanwhile, having a higher income is consistently associated with less distress and greater well-being. The authors, Noreen Goldman of Princeton and Dana Gley and Maxine Weinstein of Georgetown University, write, "Money can't buy everything, but it sure does seem to buy peace of mind, and though it's middle-aged white Americans who have suffered the greatest increases in premature death in recent years," as The Atlantic notes, the mental health changes in this study were evident in all the age groups in the survey, not just people in their middle years. Our results paint a picture of substantial social stratification in psychological health among American adults, the authors write. As The Atlantic puts it, the rich are getting happier and the poor are getting sadder. On the local front, the Bay Area is the worst in the nation for service employees and security workers, according to a new analysis by real estate website Rent Cafe. As Lewis Hansen reported, in the San Jose area, management workers averaged $87,400 in annual disposable income, the highest figure in the country, while service workers fell $10,000 short of meeting basic needs, the worst in the country. Dr. David Katz, director of the Yale University Prevention Research Center, said the study convincingly establishes the link between poverty and worsening mental health, as U.S. News & World Report reported. However, Katz added, poverty does not necessarily produce bad health outcomes in a context where everyone is poor. But when the gap between haves and have-nots is large and highly visible, it is also, apparently, quite toxic to health, both physical and mental. That is a very precautionary finding for the United States today, where wealth is ever more concentrated. You don't have to be a genius with numbers to see that these factors may well be linked to a rise in risky and self-destructive behaviors. The CDC reported last week that suicides are up nearly 30% since 1999. The failure of life to turn out as expected is consistent with people compensating through other risky behaviors such as abuse of alcohol and drug use, wrote the authors of the study, as The Atlantic noted.